Okay, so let's read about the Canadian Dental Care Plan. So, CDCP, the Canadian Dental Care Plan, is helping make the cost of dental care more affordable for eligible Canadian residents. So, if you're not covered through your employment or other private coverage that you may have, there's this option here. Application is now open for senior age 65 and over, children under the age of 18, adult with a valid federal disability tax credit certificate for 2023. Okay, renewal for 2025 to 2026 coverage period are now open for currently enrolled CDCP members. So let's see. Do you qualify? Do you so to qualify, you must meet all four of these requirements. You don't have access to dental insurance, so that would mean through your employment or other coverage. You and your spouse, common law partner if applicable, must have filed your tax return in Canada so that your family income can be assessed for the previous year. Okay? Your just family net income is less than $90,000. You are a Canadian resident for tax purposes. All right. Okay, so if you're qualified, you can click next. When you can apply. Age 65 and older, you can apply now. Adult with a valid disability tax credit certificate for 2023 can apply now. Children under the age of 18 can apply now. All remaining eligible resident not in one of the above group in 2025. So it's not yet, is it yet applicable for those in 2025? So that was, when was this updated? Modified March 3rd. So yeah, still not open for everyone. Still for children, adult, and adult with disability tax credit certificate. Okay, so to apply, it's here, and term and condition. Okay, 65 and older, disability. (16 and 17) and live independently from your parent or have a child who you are also applying for. Applying on behalf of your child. Okay. Okay, so the adult can apply for their children, basically. You can apply on behalf of your child if you are 16 or older and the child is under 18. Yeah. Okay. So that is so see if you qualify. Application, you can apply online. We can renew your coverage as well by June 1st, 2025 to avoid potential gap in coverage. When can you visit an oral health provider? Okay, so if let's say if it started and you are approved, enrollment confirmation, your start date. Sun Life managed the CDCP. Really? Okay. Sun Life. Okay. So that's a private corporation right there. Okay. Once you've applied and we've confirmed you qualify, we'll share your information with Sun Life. They will enroll you with the CDCP and send you a welcome package. It will include information on the CDCP, your member card, okay, your benefit start date, okay. Your benefit effective date will depend on when we receive the application and when we complete your enrollment. You'll need to, if you are a current CDCP member, you'll need to renew your coverage by June 1st. Okay. And you can find a CDCP oral health provider near you. Confirm that the provider will accept your coverage, know the benefit, yes, renew, additional, ask your provider if there are any costs you will have to pay in addition to your co-payment. In addition to your co-payment, never pay the full amount for services in advance. Is not possible for Sun Life to pay you back. After receiving care, you will have to pay any outstanding amount not covered by your plan directly through your provider. Okay. CDCP can search near you. Let's say, for example, Toronto, Ontario. All specialty dental, I'm guessing, all search. So yeah, you have here doctors, places, and let's actually look at this. So there's actually a lot. If I go, let's say Ottawa, search this area. Yeah, okay. So I think you should be good to find somebody. And now let's see for what services are covered. Will help you pay a portion of the cost. So it doesn't cover everything. They don't pay for everything. They help you pay a portion of the cost for a wide range of oral health care services. Services include those beyond the frequency limit that require approval in advance are available as of November 1st, 2024. Example of the services that could be covered include diagnostic and preventive services, X-ray, fluoride application, cleaning, dental exam. Okay, basic services, permanent filing, temporary filing, pain control for diseased teeth, other treatment for cavities. Okay, endodontic services. These services treat teeth that are severely decayed, infected, or broken. So CDCP covered root canal treatment, papillotomies, first step of a root canal treatment, procedure to reduce infection and relieve pain, retreatment of previously completed root canal treatment, requires pre-authorization. Okay, periodontal services. These services treat area around the teeth, including gums and bone. CDCP covers cleaning under the gum line, treating abscesses, bonding for mobile teeth require pre-authorization, post-surgical evaluation require pre-authorization, non-surgical gum disease management. Okay. Major services. This service restore teeth when they are too damaged to be fixed with basic fillings. CDCP cover posts and post removal, repairs to crown and rebounding of crown and post crown require pre-authorization. Cores to support crown require pre-authorization. Posts for crown require pre-authorization. Okay. Removal prosthodontic services, complete dentures, placing lining on dentures, indentures for comfort and healing, complete and immediate and over denture require pre-authorization, partial dentures require pre-authorization. Oral surgery. These services remove teeth or tumors and fix other problem in the mouth and jaw that need surgery. CDCP cover removal of teeth and roots, surgical removal of tumor and cyst, surgical incision including draining, treatment of broken jawbone. Okay, even jawbone treatment. Okay, anesthesia or sedation services. These are services to sedate you and control your pain while another service is being performed. So yeah, I'm guessing if you need a major treatment, you need to be sedated. So the cost for each things, I'm sure they basically split it. So to make sure you're covered, I guess they covered part of it. Now, what is the cost for all those things? Because basically, it's partially covered. They help you pay for it, so you're not fully covered. And I know if it's Sun Life it's like an insurance company. So for an insurance company, for anything, you basically pay. There's a deduction for some plans, so you probably have to pay an amount, and over that amount, that's when they help you cover it. So what is that amount? Okay, so anesthesia or sedation services. These services sedate you with control pain while another service is being performed. Okay, minimal sedation, conscious. Moderate sedation require pre-authorization. Deep sedation require pre-authorization. General anesthesia require pre-authorization. Okay, so you need pre-authorization for the things that are major. Because, yeah, okay. And, okay, let's see. Yeah, they're going to talk about the cost later on here. Note, some services include those beyond the established frequency limit while pre-authorized by the CDCP. This means your provider will recommend services and the CDCP will confirm whether they will be covered by the plan. Okay, the pre-approval must happen before you can receive these services, yes. The decision will take into consideration your oral health history and medical condition. Not all requests will be pre-approved or will be approved for coverage. You may still decide to proceed with the services proposed by your provider, even if not covered by the plan, and pay this directly to your provider. How much will be covered? There we go. The CDCP will reimburse a portion of the cost of your treatment, but you may not pay the full amount. You may have to pay additional charges directly to the oral health provider if your adjusted family net income is between $70,000 and $89,999. Okay. May not pay the full amount. You may have to pay additional charge directly if, okay, the cost of your oral health care services are more. If the cost of your oral health care services are more than what the CDCP will reimburse for these services, or you and your oral health provider agree to services that the CDCP doesn't cover. Reimbursement of service, the only oral health provider gets reimbursed for service covered under the CDCP. Only oral health providers. Okay, so they get reimbursed. Okay. If you are not covered, you shouldn't pay the full cost up front, but you may have to pay an additional charge directly to. If you are covered by the CDCP, you shouldn't pay the full cost up front. Okay. But you may have to pay an additional charge directly to the oral health provider. Yeah. Co-payment, you may have a co-payment based on your adjusted family net income. A co-payment is the percentage of the CDCP fee that is covered by the CDCP and that you will have to pay directly to the whole health provider. Your co-payment is based on your adjusted family net income. Okay. All right, let's go. Co-payment based on adjusted family net income. How much will the CDCP cover? 100%. Okay. If your income is lower than 70,000. Okay, that's good. How much will you cover? 0%. Oh. Between 70,000 and 79 $999, 60%, and the city, and you will pay 40% between 80 and 89,999. 40% is eligible coverage covered by the CDCP. 60% is covered by you. Of the CDCP established fees, you see the way they're writing it is 100% of eligible health care services cost will be covered at the CDCP established fees. At the CDCP established fees. %0 of the CDCP established fees. You may face additional charge as described below. Okay. Additional charge. The CDCP fees may not be the same as what providers charge. Yes, okay, that's what I was thinking, because they said basically the CDCP has some charge, they establish some fees for some services, and if the healthcare or here the mouth care, how do they call it here? Oral care provider, if their fee doesn't match, if it's more, then you have to pay the difference. Now, knowing that, the healthcare provider, they're probably gonna increase their rate or their fees. That would be my guess. Because if they know people are covered and the CDCP reimbursed, they say, okay, if let's say the service costs $100 and the CDCP covered $100, they're gonna be like, okay, let me charge $150 for it, and we'll tell the client the service is $150, but you only have to pay $50 because the $100 is covered by the CDCP. You see, so now the client is only hearing that information. Is like, okay, $50, let me get that service. Okay, the cost of your healthcare service is more. If the cost of your healthcare service is more than what the CDCP will reimburse for these services, yes, you and your oral health provider agree to services that the CDCP doesn't cover. Okay, so now the most important thing, I guess, would be to compare the fees the CDCP has established with the fees the healthcare the oral care provider has. How much do they charge for teeth cleaning, for example, and how much does the CDCP cover? And try to see, maybe shop around. That would be my recommendation to different places. How much do they charge, and how much is it close to the CDCP covered fees? Okay, so that was a lot of information. I don't know if okay, is there that information on how much they covered? Let me search that real quick. What is covered? Okay, to go, yes. Fees, grid, dental benefit grid. Would that help? That's the grid. Scaling, providing services, search tool, but how much is it? Services covered. Okay, for more information. Price. Fees. How much are the fees? Because if they don't have that information, then it's not very transparent of, because I'm guessing they're sharing those fees with the health care provider or with Sun Life. If they don't share it with the public, it's a little bit shady, I will say, but let's see. Let's look again. CDCP fees list services. What is covered? Don't have further information about the additional fee that the envelopers may be individual chose to be patient on this and cannot enter into a discussion about the fees on your behalf. Okay, so fees, no, there we go. CDCP information, fees, co-payment, yes, this we know. Additional charge, cost. Okay, yeah, I don't think there's. I don't think there's a list of fees. Trusted, Sun Life. Dental care. That's one time. Because they're like, okay, this is the plan. This is good. Supposedly for Canadian, we cover. But if you want the exact detail of how much is covered, there is no information. Information for oral health professional. Okay. Okay. Let me see. Confirm the services to type. So I'm guessing you just have to contact the dental care provider and they'll be the one who tell you how much the CDCP covered, because I don't think at least I'm not finding it here. It's not easily accessible. Okay, so that was the information regarding Canadian Dental Care Plan. All right.